The mini bypass is safe, but nonetheless carries with it some small risks. As with any operation, there are anaesthetic and general surgical risks such as bleeding, unintentional damage to nearby structures, deep vein thrombosis, pulmonary embolism, which is blood clots to the legs and lungs, and infection. Significant measures are put in place to reduce the risk of these from happening. In addition, the bypass carries a small risk, usually less than 1%, of leak, where the staple line or surgical joint does not heal properly. If this happens, you'll likely need additional treatment in a specialist hospital, which can last several weeks. In the early days after bariatric surgery, some people struggle with maintaining sufficient nutritional intake, which may require readmission to hospital. Sometimes this can be due to strictures or narrowing of the joint between the pouch and the bowel, which may require additional treatment to manage and treat. Due to the increased complexity of surgery, there is a slightly higher overall risk of complications compared to other less invasive procedures, such as the gastric sleeve. The risk of requiring further treatments is in the order of less than 5% of cases. The risk of any of these complications resulting in death is extremely rare and in the order of less than 1 in 2,000 cases. Because part of the intestine is being bypassed, we see a higher rate of nutritional deficiencies in the case of gastric bypass surgery compared to other options such as the gastric sleeve, for example. This highlights the importance of taking lifelong multivitamins to reduce the risk of these issues. The mini bypass is also associated with a chance of developing twists or internal hernias of the bowel due to the way in which the bypass is performed. While steps are taken to reduce the risk of this happening, the risk can never be completely eliminated. Bile reflux is a particularly unique issue related to the mini bypass. This occurs when bile produced by the liver travels into the small bowel, into the gastric pouch, and sometimes up into the esophagus, also known as the gullet or food pipe. Symptoms of bile reflux can mimic heartburn and in some cases can lead to unrelenting and severe pain and reflux. Whilst the risk of bile reflux seems to be small, it can be more difficult to treat and in some cases requires further surgery to convert the mini bypass to a full Roux-en-Y gastric bypass. Finally, significant and rapid weight loss can also result in the development of gallstones in approximately 1 in 5 people. This might require further surgery to remove the gallbladder if gallstones cause symptoms.